Hey, I'm Steve Messinio from All Access Physical Therapy, back here with Vinny Houston, the founder of AccuStretch. And in this video, what we're going to do is we're going to demonstrate how you can use the AccuStretch to stretch IT band, Pirformis, and hamstrings. So let's get started. So I'm just going to be the guinea pig here. Let Vinny take over from here.
Okay. So when you get onto the table, you want to have your legs draped into the table. Slide down a little bit more. So as this leg hangs down, it'll lock you in place. So when you're advancing the pad, you don't get pushed up the table. Okay. So these stretches are a real basic routine again for hamstring, piriformis, and IT band. So the first one we're going to do is straight leg hamstring stretch. And the beauty of this, mostly you take a leg and you start to push it, and your patient might be a little nervous about that. With the AccuStretch, you can let your client have the controls, and as they advance the pad, the fear factor is gone. They're going to go to where they feel the stretch. Some of your key triggers, your keys are, if the knee starts to bend or your other leg starts to come up off the table, then you've gone too far. And so we let the patient get into the range that they can handle, just position it well. And then and now my hands are free, there's no strain on my back, so I can actually work on the client and feel if they have any adhesions, any trigger points that we might be able to relieve. Okay.
So this is something you could do even like, say, a grasping technique where if you had grasping tools or something, you could do this type of, work on them as they're being stretched and everything else.
When you're looking for that extra set of hands to hold on to the leg, here it is.
Yeah.
Or when you go home and say, honey, hold my leg, and she says, well, here's honey, go do it yourself.
Cool. Feels pretty good.
And now we can do some P&F techniques. I can have them push against the pad, 1, 2, 3, 4, 5, relax, and then slowly advance the stretch.
Oh, wow.
I like to say sneak up on the stretch.
Yeah.
It's nice and easy, small increments to work on the stretch. Once you finish the hamstring stretch, you want to release it just a little bit.
Okay.
And slowly slide your leg across the pad. And now we can get IT band. And sometimes the opposite leg will flare out.
My IT band.
So we'll just come on over to the other side, rest our hip against it, our thigh against that, and slowly advance the stretch a little bit.
That's pretty much all I can do.
Okay. And breathe and relax. So when you're stretching on the AccuStretch, you want to go to a point where you feel the stretch, but it's not too painful, so you don't have muscle guarding preventing the stretch. You don't want to be tight. And so it's relaxation and breathing, almost like assisted yoga, where you get into a position and just let the leg relax.
This is like really great stretch on IT band, I can tell you that right now. And mine are a little tight, so this feels really good, especially with Vinny working on it. Doing a little soft tissue right there.
And specifically, where are you tight on this one?
Really, I feel it kind of right down here.
Okay. So some people feel it in different places. I've noticed some feel it in their calf, some feel it along the knee, and some feel it more into the hip. Mm-hmm. But the feedback that I get from my patient really allows me to tailor the treatment to what the patient feels and what the patient needs. And then we can do some unique stretches. So just bend your knee a little bit, externally rotate, and advance the pad a little bit more to you.
Wow, that's a great stretch. Oh.
So this is a very unique stretch.
Yeah.
Normally you're not going to put a foot diagonally across your face and body to get to this angle. And what I like about this is how it accentuates the medial and lateral portions of the hamstring, and I get total access to the belly of the muscle now. And then if I want to use some tools on it, it's a perfect way for me to use either some rolling sticks, some ice rollers, some ultrasound. What do you use?
Deep tissue laser.
Deep tissue laser.
Yeah.
So any modality where you need to have access to the leg without trying to having it positioned in just the right place that you want to be. And now I can work on it with the various tools.
That feels pretty good.
Or we can just find some trigger points and just apply some pressure to it to see if we can release some trigger points. Any angle you go at changes the angle. So if you come out wider, you get a little more hip involvement, a little more groin involvement, still getting some piriformis, still a little bit more in the hamstring, but slightly different angle. Mm-hmm. And if you can tolerate it, you can slowly advance the pad.
That feels great.
That's good. And finally, if you want, you can drop the foot at 90 degrees. So come all the way down to the other end of the pad. Remember, we're going to release it a little bit.
Release that a little.
Okay, come on down. So now 90 degrees, we're taking the hamstring out of the stretch. As we advance the pad, now we're really emphasizing the piriformis. And really good one to work on with the tools now.
That feels great.
So that's our basic 5-stretch hamstring IT band Pirformis routine. We'll be back with more.
All right, so we hope you have found that demonstration helpful. If you have an interest in learning more about the AccuStretch, then you can reach out to Vinny at vinnyh@accustretch.com or call the phone number you see here on the screen. When you do, just mention the promo code ALLACCESS. And by the way, if you have an interest in actually trying out the AccuStretch for yourself, you're more than welcome to visit my clinic and see this unit in action and see how it can work for you and for your patients. You can reach out to me at 508-845-3500 or smassinio@allaccesspt.com, and you can see that information on the screen here as well. So thanks for watching the video, and look forward to hearing from you.